Well, hello everybody. This is Andrew Bennett, and I wanted to spend just a few moments with you, just kind of musing and sharing with you some of my thoughts on what it what it takes to be a clinical faculty member, and what are the components that make up a faculty member. I've been doing the internship now for some time, probably about 5 years at the time that this recording is being done, and wanted to share with you just some ideas and some resources for you as you start on your journey in the clinical faculty. Um, so I've broken up this idea into really four parts, and I'm going to give a little bit of an overview, and then we'll dive into where some of the resources are. So clinical faculty, what does it take? Passion and connectivity. This again is just passion for our profession, a passion for teaching, and ultimately a passion for your intern, the individual that you're helping to succeed. And connectivity, the ability to get inside their skin just a little bit, to get inside their head, to know what makes them tick, to know how to push their buttons, to know when to push and to demand, and when to encourage, and simply give them a space to breathe. This is also about the ability to connect with your patients. It's going to be very different for many of you. You're used to being in the clinic and having that very intimate relationship with our patients that gets developed through just the provider-patient relationship model. This is going to be a little different, and it's going to challenge you to practice techniques to be able to connect with your patient when you're not the one putting your hands on their painful part, where you're not the one spending the 20 to 30 minutes in a physical exam with them. This will be something we'll talk through. Another pillar is validating the intern and elevating the patient's experience. Validating the intern meaning saying yes often. There's a cardinal rule in improv comedy that you never disagree with your partner. In other words, if I were doing an improv stand-up with John Childs, and John were to look at me and say, Andrew, did you see the purple dinosaur that was just in the bathroom? Well, the rules of improv comedy would say I would never say no, because then that would end sort of the momentum. But I would say yes and. So did I see the purple dinosaur in the bathroom? Yes. And did you see that he had green spots on his tail? So by saying yes and to the intern, we have the ability to validate them in front of the patient. So, Dr. Bennett, I believe that it is patellofemoral pain. Yes, and let me show you how, when you incorporate a slump test in the diagnostic, you'll better be able to treat that patellofemoral pain. Do you see how I did that? It wasn't a no, you're wrong, but it was a yes and. There is patellofemoral pain, but here's how we're going to better treat it. And by validating the intern, we actually elevate those patients' experience. And ultimately, that's what the internship is all about. And we'll spend a few more minutes talking about that shortly. Now, on sort of the non-creative side of the clinical faculty is this idea of just the technical nuts and bolts of how does it work. How do you need to prepare? What's your schedule look like? How many techs do you need to have? What are the hours in the clinic? How do you manage the clinical faculty role of the reviews, the CPI, that type of thing? And so I'll share some of that with you. And then finally, some teaching tools. Meaning that some of us are perhaps a little more talented than others. Some of us have had less experience than others in terms of what it takes to teach. And so what I've done is I've tried to learn more, because this is something I feel like I am constantly trying to get better at, is looking for different tools and understanding how to learn and how to teach. Some things like the 4 quadrants of learning, situational leadership model, um, learning styles, how to leverage myself to teach, and by getting the interns immediately useful. In other words, at what point can you delegate tasks so that you have some time carved out of your schedule? So those are really the 4 main areas, and what I thought I would do is just pause the video now, and then we'll break it down into the individual parts.